You're listening to episode 12 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness researchers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Rebecca Williams and Julie Kraft join us to speak about their co-authored The Mindfulness Workbook for Addiction. Many people are introduced to mindfulness through its efficacy with stress reduction. Increasingly, however, this practice is being recognized for helping in other areas of human suffering. In particular, how mindfulness can have a positive impact on those dealing with addiction. Rebecca E. Williams, Ph.D., is a psychologist, teacher, author, and mentor. She specializes in recovery from mental illness and addictions. She received her master's degree from Harvard University and her PhD from the University of California, Santa Barbara. She is currently a clinic director at the Veterans Affairs San Diego Healthcare System. In addition, she is an associate clinical professor in the Department of Psychiatry at the University of California, San Diego, and an adjunct faculty member at the University of San Diego. Dr. Williams is co-author of another book entitled Couple Therapy for Alcoholism, a Cognitive Behavioral Treatment Manual. She has a psychotherapy practice in San Diego, California. Julie S. Kraft, LMFT, is a licensed marriage and family therapist. She received her master's degree in marriage and family therapy from the University of San Diego's School of Leadership and Education Sciences. She has provided counseling to veterans and their family members at the Veterans Affairs San Diego Healthcare System and has provided psychotherapy to individuals, couples, families, and groups in community settings. In her current position with Sharp Healthcare, she treats clients struggling with both addiction and mental health concerns. Julie also sees clients in her private practice, treating such concerns as relationship issues, anxiety, depression, and substance abuse. She lives and works in San Diego, California. Our guests today are Rebecca Williams. Rebecca, thank you for being here.
Thank you for having me.
And Julie Kraft. Julie, thank you for joining us on Present Moment.
I'm happy to be here.
So let's talk a bit about your backgrounds, this intersection of mindfulness practice with addiction therapy. Rebecca, let's start with you. How did you first encounter mindfulness?
Well, that's a great question. I'm a psychologist by trade, but I put it also practicing yoga for about 30 years now. It's been a lifelong joy for me to use yoga to calm myself down and keep myself healthy and happy. And I noticed that when I do yoga and learn mindfulness in that regard, it helps me as a psychologist. So I've been trying for years to figure out a way to incorporate my mindfulness and meditation with the practice of psychology. And this was a natural progression to bring it into the practice.
Great. And Julie, how about you? How did your experience with mindfulness begin?
I first learned about mindfulness in my studies as a therapist. They are slowly starting to incorporate mindfulness into more of the therapeutic techniques. So something like DBT, which is dialectical behavioral therapy, which has been proven to be very effective for people that struggle a great deal with strong emotions. So it is starting to work its way into the field. So I did learn about it in school a bit. But I also have had my own experiences with being very mindless in my life, really around, mindless eating and that kind of behavior, which I think is very common. So I went ahead and took a class here at UCSD on mindful eating, and that was a big turnaround for me. I learned a lot about how to bring more present moment awareness into the eating behaviors.
And how have you resonated with these practices and brought them into your own practices in terms of addiction therapy? Because I know that's also a part of your experience each. Julie, how about you? Starting with you on that one.
Yeah, I think it's a natural fit, as Rebecca was saying. Encountering those who are dealing with addiction, especially brand new in recovery, the emotions are so strong. They are so intense, and a lot of them have been avoiding emotions for so long that really bringing anything that calms the situation, that brings more groundedness, and even just teaching people to tune in and be aware of their emotions and their thoughts, even physical sensations that are going, without awareness. Was just a really natural progression in terms of how to treat, patients I was working with at a local hospital in outpatient therapy for their addictions, again, brand new in recovery. So started doing things like, brief mindfulness exercises in our groups, brief meditations, even breathing exercises where we bring that mindful attention to the breath. I've seen just great results for people. It would take, 2 to 5 minutes and the entire tone of the group will have changed. And anytime you experience something like that is very positive.
Rebecca, how about you? How have you incorporated mindfulness practices with your own therapy?
Well, I start at the beginning and the basics, which is my office space and my own mind. So I want to make sure my environment is very calm, clean, and available for both clients. And I also do supervision with other trainees and marriage and family therapists and other psychologists in training. So I try to start at the beginning. So I want to look in my office, make sure everything is soothing, relaxing, and mindful so I can create an environment and bring either patients or trainees into my environment and make sure they can calm down, relax their own minds and bodies so that they can process what's going on for them as therapists and what's going on for them as clients. So that's my starting point. And from there, I certainly use mindfulness skills with clients and with trainees. Similar to what Julie said, we start with breathing. We focus on diaphragm breathing, making sure that the client can center themselves in order to do the challenging work of psychotherapy.
Wonderful. Thank you. So how did the two of you come to collaborate on the book itself?
I can start with that one. Speaking of trainees, Julie was one of my trainees a couple of years ago. I saw a spark in her, very bright, very in tune with excellent outcomes with clients, and I really wanted to work deeper with her in terms of bringing some of our conversations to fruition with a book. And we worked really closely together, a lot of trust, a lot of respect, and put together some ideas that were picked up by New Harbinger as very useful for the New Harbinger Workbook series.
And Julie, how about for you, that experience of partnering with someone you had as a mentor role before? How was that experience for you in collaborating on the book?
Well, I would say Rebecca's still a mentor and probably always will be, even though we did collaborate on this piece. It was extraordinary to have this opportunity. I mean, obviously working under Rebecca and learning so much from her, knowing what she brings to the field clinically is just extraordinary. So having the opportunity to work more closely with her on a project was huge. But I also really could see that she had conceptualized this idea for the book for years. I mean, I think she can probably speak to that, but she had said that this was really, rattling around in her mind, this idea of loss being such a huge trigger for addictive behaviors. And she had seen this again and again clinically and felt that there was really something missing from the addiction field in terms of dealing with loss in a mindful way. So listening to her when we first sat down to collaborate and hearing, all the expertise that she was bringing to this and this, fantastic idea of integrating the loss and the mindfulness, was just fantastic. And so it was a wonderful process writing the book. It gave me a chance to sit down with Rebecca and think about, clients that we will never meet. What do they need from us? People that pick up the workbook, somewhere in another state that, will never interact with us directly. We wanted to speak to them in a way that they could, receive the skills and learn something from this. So it was a great way to think about the writing.
So tell us about the book. It's a workbook, so a bit more hands-on.
Yeah, the workbook is exactly hands-on, Ted. I couldn't have said it better myself. What's interesting, since it's been about a year, I'm getting emails from across the country from all sorts of different folks who are using the book. It's at a very manageable reading level. I think New Harbinger requested that we put it at like a 9th or 10th grade reading level so that it can be accessible for anybody, for everything from teenagers are picking up the book in recovery centers all the way to prisoners who are incarcerated. I've gotten emails across the country, folks wanting to use the book in the prison system, which we are thrilled about. I mean, can you imagine getting a workbook like this on mindfulness into the prison system? I'm thrilled. We're both super thrilled about that. So the book is extremely friendly. There are 64 worksheets and handouts that any counselor can Xerox and use for any session. And I think just the ability to be able to pick it up really at any point in the book and use a worksheet for counselors to use, also for clients to use, is really why it's so user-friendly.
Have you been able to incorporate some of what you have in the book into your own private practice, or is it something that the book really represents what you're already doing with your clients?
Yeah, I think it's a little bit of both. I think part of the fun of writing the book was to have all of these ideas and concepts, in a workbook form that was easy for me to bring to clients and to photocopy and just kind of have it at the ready. So, concepts that we were already using with clients now really easily accessible and all in this, this format, start to finish, kind of a process to move through has just been great. And it is, I think very accessible to clients. We wrote it in a really friendly way. It's warm. It's sometimes, as you probably know, the addiction treatments of old were very confrontational, very aggressive. Addiction was the one field in which, clients would get attacked. This idea of kind of ripping their defenses away and getting rid of the denial. It was quite aggressive. So there's been, luckily, a wonderful shift towards a more mindful approach and a more loving approach in addiction. And this book is really in keeping with that. It's very warm.
You mentioned the use of the book in the prison system, and I imagine that mindfulness practices, just through some other experiences that we've had, can help reduce recidivism. Have you found that the book itself, since it's been published about a year ago, has grown into other areas that you just didn't contemplate when you first published it?
I actually know it's being used now in some eating disorder programs. And that was not something I had anticipated, that eating disorders are very similar to addictive behaviors, although there are some differences. But when we originally were writing the book, that wasn't an audience that we were writing for, but it's become quite useful to them. And that's been really exciting because, of course, eating disorders are quite devastating.
Yeah, I agree. The eating disorder field is another field that does require some compassion and self-compassion and loving kindness. So this works great with that population. I think the other area that it's been picked up quite a bit on is the grief and bereavement population. I knew that addiction and loss went really tightly together in terms of understanding addiction and the addiction pathway. I really was surprised to get so many emails from folks who, websites similar, to yours, where they're really trying to focus on managing loss and grief, bereavement. So we're just really thrilled to be able to have it branch out a little further than just addiction for drugs and alcohol.
So what is it that you hope people get out of the book above and beyond the regular dealing with their addictions?
Yeah, I think we're looking a lot at better management of emotions, better management of thoughts, and also better management of relationships. So one of the longest chapters and the most thorough chapters in the book is chapter 9, which is the relationships chapter. just huge. I myself am a marriage and family therapist, so of course, my training is focused on relationships and how they influence our lives and vice versa. So I do think that's a really important component for people to get out of this, just basic communication skills, enhancing relationships that we have, building relationships that we want. Getting away from isolation, which is such a big issue in addiction, and building healthy relationships is a big piece. But also this, we integrated, DBT, dialectical behavioral therapy, cognitive behavioral therapy, and acceptance and commitment therapy. So these multiple therapies that are focused on mood management and on management of our thoughts and behaviors. So really, aside from addiction, we could all use some of these skills big time in just coping with strong emotions, experiences that we have, and a lot of times just our thoughts. So, we walk around all day having interpretations of our experience, right, which is our thoughts. And if we can interpret our experiences in a more positive and healthy way, it just changes everything. So that's something we hope people to get.
You also have a website, mindfulnessworkbook.com, which will be linked on the episode page for this episode. And there's a blog there as well. Can you tell us a little bit more about the site and what's on it?
Yeah, it's a simple, easy-to-read site, similar to our style. And again, it's warm and inviting. And the purpose of the website is to, as you said, link to the book. But it's also, the blog helps you, anyone who takes a look at it helps them just warmly understand that the mind can chatter and be, like we say in Buddhism, a monkey mind, where it's jumping all over the place. And the blog is just a way to remind ourselves just to calm down. There is a way to make peace with the mind, and it's normal for things to get out of hand, but it's also normal to bring yourself back to the present moment, which is why I love your website so much, too.
Thanks. Appreciate that. So are there any particular recommendations you would make for those suffering from addiction or their loved ones who might be listening?
Yeah, I think, the first thing to know when you are struggling with an addiction is that you are definitely not alone. Unfortunately, this is a widespread issue. As Rebecca mentioned, not only substance abuse, but all kinds of addictive and compulsive behaviors, gambling, pornography, sexuality, etc., shopping. There are many behaviors that can just start to slowly, unfortunately, take over a person's life. And become, more important than the things that they actually value in life, which is when you start to notice the problem. So I would say, there's a lot of support out there, gratefully. There are many valuable treatment programs. For those who, don't have a lot of money to spend, there's always 12-step groups. There's a 12-step group for just about every addiction you can think of, and for every compulsion, every disorder. So there is, free support in the community. You can find others who've been through the similar issue who are willing to offer continuous support. So looking into these, thank God now we have the internet. We can use it for, searching out this kind of recovery community that's out there for us. And I think that's a great place to start. There's a lot of hope.
Yeah, I would also add to what Julie said, the mindful meditation and potentially yoga opportunities that are available. If you have an addictive behavior and you need help, trying to calm the mind down with a class, a mindfulness class, a mindfulness workshop is extremely helpful as a starting point. In addition, we have in our book, at the end of our book, we have resources for the journey. There's about 50 books and ideas in the back of the book to help anybody, whether you're a therapist or a client or just someone who's curious. It'll help you start the journey or continue your journey to be well and be strong.
In the writing of the book and the gathering of the background information that led to it, were there any particular stories or events that stood out to you as being inspiring and remindful of you as to why you were putting it together?
Gosh, I'm racking my brain. I think there's, several that come to mind. For me, working at as I mentioned, at one of the local hospitals here, Sharp Mesa Vista Hospital, I was working in an outpatient program. So many of my clients had just come out of detoxing from alcohol or several of them opiate painkillers. And so working with them in groups and again, seeing some of this mindfulness, these brief mindfulness exercises, just being a huge shift. I did have one patient who had been through a terrible car accident and was in chronic pain for, the past couple of decades and was now trying to get off of his pain medication. And mindfulness was huge for him. He would do mindfulness or meditation podcasts. He had an app on his phone that we talked about him getting to help him sleep at night, to do these kinds of exercises before bed. He learned to kind of sit in his car sometimes when he was getting overwhelmed at work, and to do one of these exercises. And it was really life-changing for him. I got a Christmas card, a year later. That's the kind of thing that just really warms your heart when they're still practicing these behaviors, still sober. And that's just huge.
Yeah, that's a great story. I probably have 20 stories just like that. I work at the VA hospital, and there daily I see successful, positive stories. But my own personal story is really that I saw my mother struggle with addiction for decades, and I really felt like I could have done more. She's gone now, but I really think this book is a tribute to my ability to kind of take a step back, look at what she might have needed in terms of getting well herself, and being able to get it out there to as many people as possible. So that's my private story that is really inspirational for me.
Well, thank you both so much for sharing that. The book is the Mindfulness Workbook for Addiction, and we've been speaking with the authors Rebecca Williams. Rebecca, thank you so much for being here.
Thank you for having us.
And Julie Kraft. Julie, thank you for joining us.
Great.
Today's quote is from Jon Kabat-Zinn's book, Wherever You Go, There You Are, Mindfulness Meditation in Everyday Life. We use the word practice to describe the cultivation of mindfulness, but it is not meant in the usual sense of a repetitive rehearsing to get better and better so that a performance or a competition will go as well as possible. Mindfulness practice means that we commit fully in each moment to being present. There is no performance. There is just this moment. We are not trying to improve or to get anywhere else. We are not even running after special insights or visions, nor are we forcing ourselves to be non-judgmental, calm, or relaxed. And we are certainly not promoting self-consciousness or indulging in self-preoccupation. Rather, we are simply inviting ourselves to interface with this moment in full awareness, with the intention to embody as best we can an orientation of calmness, mindfulness, and equanimity right here and right now. Thanks for listening. If you'd like to hear more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.